Does knee pain mean you have to stop working out? Absolutely not. The right kind of movement can actually help reduce pain and keep you feeling strong. Let me show you how to stay active without making things worse. And I know it can be scary when your knees hurt. You might worry about making the pain worse or even injuring yourself further. But here's the truth, avoiding exercise entirely can often do more harm than good. Your body needs movement to stay healthy, and movement is key to recovery. In this video, I'll share why movement is so important for knee pain, which exercises are safe and effective, and also which exercises, not necessarily to avoid, but maybe to modify. So stick around, let's keep you moving safely and feeling confident in your knees. My name's Dr. John Schaefer. I'm a physical therapist, strength conditioning coach, I'm board certified in orthopedics, and I've helped hundreds of people overcome knee pain, both online and in person. And I want to help you do the same so that you can feel confident in your knees to get the most out of your knees and the most out of your life. So here's the thing about knee pain. The less you move, the stiffer and more painful your knees can get. Because movement is like WD-40 for your joints. It keeps them lubricated, can reduce stiffness, and actually eases the pain. But it doesn't stop there. Regular movement strengthens the muscles around your knee. So think about the quads, the hamstrings, the glutes. These muscles are like bodyguards for the knees, helping stabilize and protect them from any further irritation or injury. So let's take a look at the knee joint here. So again, you've got your knee above, you have your quads in the front, in the back, you've got your hamstrings, and then a little bit higher up, you've got your glutes or your hip muscles. The stronger we can get all those muscles surrounding the knees, the more that can make up for any irritation to the tissue or the joint. So every time that you work on strengthening those muscles, you can think of that as an insurance policy protecting against any of that discomfort or irritation you might be having. Or if you're not having any injury or irritation currently, again, that's setting yourself up with a little bit more protection for the future. And let's not forget about the mental side of things. So staying active is not just good for your body, it's a huge win for your mind as well. Moving keeps you motivated, it can reduce your stress, and it also gives you a sense of control over your recovery. So things maybe might not be going as well as you want, but every time you take a step forward, doing just a little bit of movement, that's a small win that you can stack, and it gives you, again, a little bit more control over what sorts of things you're dealing with. And you might have heard things like maybe no pain, no gain, or maybe you're avoiding exercise out of fear. But the truth is, you don't need to push into pain to see progress. But stopping all movement isn't the answer either. The key is finding the right balance in between. So finding movements that are comfortable, movements that you can, do without a significant increase in pain, without pushing to limits where you're sore for super long periods of time and don't want to exercise, for several days or weeks. So let me show you how to do just that. Let's start with some knee-friendly options that will keep you active without aggravating your pain. So I want to talk about two different styles of exercise you can try to incorporate. The first is low impact cardio. So if you're looking for cardio, stationary cycling or swimming is perfect. Both of them get your heart rate out without putting unnecessary strain on the knees. These are both what we would call non-weight bearing activities, meaning, you're not putting a lot of weight through the knees when you're swimming. Obviously, we have the effects of water reducing the amount of pressure through the joint. And then when you're cycling or doing a stationary bike, you're not putting weight through those joints either. But it's also important that we incorporate strength exercises as well. So body weight moves like squats to a chair, what we call like a sit to stand, glute bridges and heel raises are all great for building the muscles that support the knees. So it's super important that, even though you might be doing some of these more non-weight bearing exercises, we also are stressing the joints in that weight bearing position so that we can get strong, for everyday activities. Because at the end of the day, you are weight bearing the majority of the day. So we'll talk a little bit about modifications next. So a simple modification for squats. If you can't do a squat comfortably unsupported, meaning you're just squatting down with weights and standing back up, you can also do this by standing in front of a chair with your feet about shoulder width apart. Lower yourself down towards the chair, tap your hips against the chair, and then rise back up. And if even that's too difficult, what you can do is stack pillows so that that surface is a little bit higher. The key is to find an entry point to that movement. So maybe it's a situation where you're just hanging onto the side of the counter and doing a mini squat. Again, not going quite as low initially, but that's something that you can build up over time as well. Outside of strengthening, stretching is also super, super important. So don't forget to incorporate some sort of stretching, some sort of mobility work. Tight muscles such as the calves, the hamstrings, and the hips can create extra tension around your knees. So stretching these areas can also reduce any kind of pull that keeps your, uh, and this will just keep your knees feeling a little bit looser overall as well. But regardless of the exercise, the activity you're doing, it's so important that you're listening to your body. So remember, it's not about pushing through discomfort. It's not about pushing your body to the max. It's staying within pain-free ranges, listening to your body, listening to what it's telling you. And a little muscle soreness is okay, but if you're feeling sharp pain, that's your cue to either stop or adjust. Next, let's talk a little bit about what to avoid or what sorts of exercises to be a little bit more cautious with. So, high impact activities, so think about like running, jumping, high intensity interval training. All those might be a little bit too much if the knees are irritated. This isn't to say you'll never be able to do those activities. It just means while you're rehabbing, we want to start a little bit slower and avoid those activities that are such high impact initially. The next is deep squats or lunge. So these moves can put a lot of strain through the joint, especially if you have limited range of motion currently. So what I'd recommend in this case is working on getting that motion back first, starting with a mini squat or mini lunge within a comfortable range and then building that up over time. So like I said, there's always ways that you can modify. There's always different alternatives. So if running bothers the knee, start with walking, start with cycling, and then transition back to running slowly. And if squats are feeling tough, try partial squats. You can use a chair for support, like we talked about earlier. But the key is modifying these movements to work for you, not against you. There's not any one size fits all approach. It's just options to keep you active safely. There's always an entry point to movement. There's always something you can do to continue to move. It's not a situation where if you have pain, you're out of luck. You can't move, you can't do anything. There's always ways you can keep moving. And that's going to be the main takeaway from this video. If you get nothing else, there's always ways to keep moving. So, knee pain does not always mean you have to stop exercising. Movement, when done right, can actually help you feel better, get stronger, and stay in control of your recovery. So, modify those exercises, stay consistent, and most importantly, listen to your body throughout the process. So I want you to drop a comment below and tell me what's your favorite knee-friendly exercise or what exercise do you want to get back to that you're not able to currently. And if you want a complete plan to help you relieve your knee pain, build strength, get back to doing the things you love, I want you to simply comment knee in the comments and I'll send you my free guide. It's a 4-step plan to get out of knee pain. And then I'll also put my phone number if you want to text me to do an online evaluation. I'm always more than happy to see if this is something that I can help with. Thanks so much for watching, and we will see you in the next one.